Welcome back to the channel. I need you to stop what you're doing right now, because what I'm about to share with you is something most doctors will never bring up during a routine checkup. And honestly, that silence might be costing older men their health, their vitality, and even years of their lives. I'm Dr. Anandi Joshi, a urologist with over 2 decades of clinical experience. And today, we are talking about something that makes people uncomfortable, but the science is too important to ignore. If you are an older man and you are not ejaculating regularly, you need to start today. Because the research is not subtle about this. A landmark study out of Harvard Medical School followed nearly 32,000 men over 18 years and found that men who ejaculated 21 or more times per month had a 33% lower risk of prostate cancer compared to men who ejaculated 4 to 7 times per month. 33%. That is not a rounding error. That is not a footnote. That is a clinically significant reduction in one of the most common cancers affecting men over the age of 60. And yet, I can almost guarantee your last doctor's appointment did not include a conversation about this. We are going to fix that today. Now, before we dive in, I want to ask you something directly. Leave a comment below telling me your age and whether your doctor has ever spoken to you about sexual health and prostate function in the same breath. I read every single comment on this channel, and your answer genuinely helps me make better content for you. And I want to tell you something. You are not alone in navigating this. Thousands of men your age are watching this right now, and they deserve the truth just as much as you do. In this video, I am going to walk you through 6 powerful science-backed reasons why regular ejaculation is one of the most underrated health tools available to men over 60. We are going to count down from 6 to 1, with number 1 being the most dramatic finding I have come across in my entire career. And I promise you, by the time we get to number 1, you will understand why I felt compelled to make this video. So stay with me all the way through. Starting at number 6, and this one surprises almost every patient I share it with. Regular ejaculation has a measurable, documented impact on your sleep quality. Now you might be thinking, what does one have to do with the other? Let me explain. The moment of ejaculation triggers a powerful release of a hormone called prolactin. Think of prolactin like a biological off switch. It signals to your nervous system that a major physiological event has concluded and it is time to rest and recover. Prolactin works in partnership with oxytocin and serotonin, 2 of your brain's most important calming messengers. Research published in the journal Hormones and Behavior found that men who had regular sexual release reported significantly better sleep onset, longer sleep duration, and more restorative slow-wave sleep compared to those who did not. Now, here is why this matters more after 60 than it ever did at 30. After the age of 65, your body's natural melatonin production begins declining by roughly 10% per decade. Your circadian rhythm becomes less robust. Deep sleep, the kind where your body repairs tissue, consolidates memory, and regulates inflammation, becomes harder and harder to achieve. So anything that naturally nudges your body toward deeper, more restorative sleep is not a luxury. It is medicine. I had a patient named Gerald, 71 years old, a retired electrician from Pune, who came to me complaining of exhaustion, brain fog, and low mood. He had been prescribed 2 different sleep aids in the prior year. After a thorough evaluation and a very frank conversation, we identified that his sexual activity had essentially stopped after his wife passed 3 years earlier. Within 6 weeks of resuming regular self-stimulation as part of a broader wellness plan, Gerald told me, and I will never forget this. He said, "Doctor, I feel like someone turned a light back on." His sleep scores improved, his energy returned, and we were able to take him off one of his sleep medications within 4 months. Number 5 on our list is cardiovascular health, and this one has some of the most compelling data I have seen in 20 years of practice. A study conducted by researchers at the New England Research Institute found that men who had sex or reached climax at least twice per week had a 50% lower risk of fatal heart attack compared to men who had sexual release less than once a month. 50%. Let me give you the biology behind that number because it is important. During sexual arousal and ejaculation, your heart rate elevates, your blood vessels dilate, and your body releases nitric oxide, a molecule that acts like a power washer for your arterial walls. Think of nitric oxide as a traffic control system for your blood vessels, opening lanes and clearing congestion so blood can flow freely. After 70, most men experience a significant reduction in natural nitric oxide production. The endothelium, that is the thin inner lining of your blood vessels, becomes stiffer and less responsive. Regular ejaculation provides a rhythmic stimulus that keeps this system exercised and active, very much the way light jogging keeps leg muscles from atrophying. The cardiovascular benefits are not just theoretical. They show up in blood pressure measurements, in arterial flexibility scores, and in long-term mortality data. I want you to understand that every time your heart works through that cycle, you are doing something genuinely protective for your circulatory system. Moving to number 4, and this is one I discuss frequently at men's health seminars. The impact of regular ejaculation on your testosterone and hormonal ecosystem. Now, many men over 60 have been told their testosterone is declining, and there is not much they can do about it short of hormone replacement therapy. But that is an incomplete picture. Research from Konkuk University in South Korea found that men who abstained from ejaculation for 3 weeks experienced a significant drop in androgen receptor sensitivity, meaning even the testosterone they had was less effective at doing its job. Regular sexual activity and ejaculation keeps your androgen receptors primed and responsive. Here is the deeper mechanism. As men age, something called anabolic resistance sets in. Anabolic resistance means your body requires stronger, more consistent hormonal signals to maintain muscle mass, bone density, and metabolic function. Think of it like a door that used to open with a gentle knock but now requires a firm, sustained push. Regular ejaculation is one of those firm, consistent pushes that tells your endocrine system, your hormone-producing system, to stay alert and responsive. It supports the feedback loop between your brain, your pituitary gland, and your testes that keeps testosterone production functioning at its best possible level for your age. I had a patient, Ramesh, 68, a former schoolteacher from Nagpur, who reported feeling increasingly fatigued and emotionally flat. His testosterone was in the low normal range, technically not deficient, but clearly not optimal. As part of a lifestyle intervention that included regular sexual activity, targeted nutrition, and resistance exercise, his free testosterone rose by 22% over 8 months. He did not need pharmaceutical intervention. He needed his own biology to be stimulated appropriately. Now, before we get to the top 3, and I promise you, number 1 alone is worth staying until the end. If this video is giving you information you have never heard from a doctor before, please take a moment right now to hit that like button and subscribe to this channel. It genuinely helps this information reach more men who need it. There are men in their 70s watching this right now who have been quietly suffering, feeling like their bodies are simply broken, when the truth is they just haven't been given the right information. Your click helps us reach them. I thank you for that. Number 3 is one of the most fascinating intersections of urology and neuroscience I have ever encountered. The relationship between regular ejaculation and cognitive function, specifically the protection of brain health as you age. Researchers at Coventry University in the United Kingdom studied over 7,000 adults over the age of 50 and found that those who reported regular sexual activity scored significantly higher on tests of memory recall, verbal fluency, and numerical reasoning. The effect was strongest in men over 65. Now, why would ejaculation affect your brain? The answer lies in a protein called BDNF, brain-derived neurotrophic factor. Think of BDNF as fertilizer for your neurons. It encourages the growth of new neural connections, protects existing brain cells from damage, and is critically involved in the formation of new memories. The sexual response cycle, including ejaculation, triggers a measurable spike in BDNF levels. It also reduces cortisol, your primary stress hormone, which, when chronically elevated, literally shrinks the hippocampus, the brain region most responsible for memory and spatial navigation. After the age of 70, your brain loses roughly 5% of its hippocampal volume per decade under normal circumstances. Chronic cortisol elevation accelerates that loss dramatically. Regular ejaculation provides a natural, drug-free mechanism to lower cortisol, flood the brain with BDNF, and keep the neural architecture of memory and cognition in much better shape. I think about a patient named Victor, 74, a retired bank manager from Chennai, who came to me worried about memory. His wife had noticed he was repeating himself. After a comprehensive evaluation that ruled out early dementia, we identified profound isolation and almost complete absence of physical intimacy since his health had declined. As part of his care plan, we worked with a counselor and encouraged him to reintegrate regular sexual wellness practices. Over the following year, his cognitive assessments improved. His wife called me personally to say the man she married had come back to her. Number 2, and I want you to lean in for this one because most urologists will not tell you this directly. Regular ejaculation is one of the most powerful natural tools for protecting the structural integrity of your prostate gland. I am not just talking about cancer risk now. I am talking about the daily functioning of a gland that affects urination, sexual function, and pelvic floor health. The prostate constantly produces prostatic fluid, a critical component of semen. When ejaculation does not occur regularly, that fluid accumulates. Stagnant prostatic fluid is an ideal environment for inflammatory mediators, crystalline deposits, and even bacterial colonies to develop. This is sometimes called prostatic congestion, and it is a real documented contributor to a condition called chronic prostatitis, which causes pelvic pain, urinary difficulty, and sexual dysfunction. A study published in the British Journal of Urology International found that men with chronic prostatitis who increased their ejaculation frequency experienced a 40% reduction in pelvic pain scores and a 31% improvement in urinary flow rate within 12 weeks. Think of your prostate like a gland that needs to be flushed regularly to stay healthy. Very much the way your eyes need to blink to keep the surface clean and lubricated. When the flushing stops, stagnation and inflammation take over. After the age of 65, the prostate is already dealing with hormonal changes that promote enlargement, a condition called benign prostatic hyperplasia. Adding stagnant fluid and inflammation on top of that is like throwing debris into an already narrowing pipe. Regular ejaculation is not a perfect solution, but it is a genuine, evidence-based tool for maintaining prostatic drainage and reducing the inflammatory burden on a gland that is working harder than it ever has. I had a patient named Suresh, 66, a retired military officer from Hyderabad, who had been dealing with chronic pelvic pain for 4 years. He had been through 2 rounds of antibiotics, a procedure to assess his bladder, and countless uncomfortable examinations. When I reviewed his history, one of the first things I asked was about his sexual activity. He had stopped entirely after his prostate issues began, believing, as many men do, that sexual activity would make things worse. In fact, the opposite was true. Within 3 months of resuming regular ejaculation, combined with targeted pelvic floor therapy, Suresh's pain scores dropped by over half. He sent me a message 6 months later that simply said, "I feel human again." And now number 1. The reason I made this video, the reason I am asking you to share this with every older man you know. Regular ejaculation has been directly linked to a statistically significant reduction in all-cause mortality in older men. Not just prostate cancer, not just heart disease, all-cause mortality, meaning death from any cause. A 25-year longitudinal study published in the British Medical Journal tracking nearly 1,000 men between the ages of 45 and 75 found that men with the highest frequency of orgasm had a 50% lower mortality rate than men with the lowest frequency, 50% lower risk of dying from anything. The researchers controlled for pre-existing health conditions, lifestyle factors, and socioeconomic status. The association held firm. This is not a correlation buried in noise. This is a landmark finding that should have changed how medicine talks to older men, and largely did not. The mechanisms behind this finding pull together everything we have discussed today and then some. Regular ejaculation reduces systemic inflammation. And after the age of 70, chronic low-grade inflammation, sometimes called inflammaging, is one of the primary biological drivers of nearly every age-related disease from Alzheimer's to cardiovascular failure to type 2 diabetes. It optimizes mitochondrial function, mitochondria being the energy-generating organelles inside every cell in your body. After 75, your mitochondrial efficiency can drop by as much as 35%, meaning your cells are literally running on a weaker battery. The hormonal and neurochemical cascade triggered by regular ejaculation helps maintain mitochondrial output in ways that researchers are only beginning to fully quantify. It regulates the autonomic nervous system, the balance between your fight-or-flight response and your rest and repair response, keeping your body in a state of physiological resilience rather than chronic stress. And it maintains the psychological sense of agency, embodiment, and connection to life that is, frankly, one of the most powerful predictors of longevity we have in medicine. I want to be clear about something. Regular ejaculation does not require a partner. It does not require you to be in perfect health. It does not require youth. It requires only that you understand this is not a luxury or an indulgence. It is a physiological maintenance practice, as legitimate and important as taking your blood pressure medication or going for your morning walk. The men who live longest are not the men who gave everything up in their 60s and quietly faded. They are the men who stayed engaged with life, in every sense of that word. Now, practically speaking, the research suggests that the benefits begin to accumulate at around 2 to 3 times per week for men under 70, and even once or twice per week shows measurable benefit for men over 75. Consistency matters more than frequency. Your body responds to regularity the same way it responds to regular exercise. The stimulus needs to be recurring for the adaptation to take hold. Pair this with adequate hydration, zinc-rich foods like pumpkin seeds and legumes which support prostatic fluid quality, and pelvic floor exercises, often called Kegel exercises, to maintain the muscular integrity that supports both urinary and sexual function. If you are on medications that affect sexual function, speak with your urologist specifically about this. There are options, and that conversation is worth having. All referenced studies and resources are listed in the description below this video. Here's what I want to leave you with. So many of the men who come to my clinic in their late 60s and 70s have been told in subtle and not so subtle ways that their sexual health is behind them, that this chapter is closed, that the body they have now is simply a diminished version of what it once was, and the best they can do is manage the decline. I reject that completely. The science rejects it completely. Your body at 65, at 70, at 78 is still a system that responds to the right inputs. It still has the capacity to repair, to optimize, to protect itself, if you give it what it needs. Regular ejaculation is one of those inputs. It is not a small thing. It is connected to your heart, your brain, your prostate, your hormones, your sleep, and according to the best longitudinal data we have, your very lifespan. It is never too late. I have seen men in their late 70s reclaim their energy, their clarity, and their sense of self. I have seen marriages reignite. I have seen men come off medications they had been on for years. The body wants to heal. Your job is simply to stop standing in its way. If this video gave you something valuable today, something your doctor has not told you, please share it with someone who needs to hear it. Subscribe to this channel because we publish this kind of evidence-based, frank, no-nonsense information every single week. And leave me a comment below right now. How old are you? And has your doctor ever had this conversation with you honestly? I am reading every response. I want to know, because you deserve a doctor who talks to you like an adult, who respects your intelligence, and who believes that your best years of health are not necessarily behind you. I am Dr. Anandi Joshi. Thank you for watching. Take care of yourselves, all of yourselves.